Do you believe that sometimes the very health checkups that seem to protect you might actually be quietly pulling you closer to the operating table or even to cancer? It sounds unbelievable, does it not? Yet every year, millions of people over 70 continue to go through the tests their doctors recommend, convinced that preventing illness is always better than treating it later. But what if the truth is completely different? What if some tests do not save many lives at all, and instead create anxiety, lead to unnecessary treatments, cause long-lasting side effects, and turn the peaceful years of old age into days filled with confusion and fear? Recent studies warn that there are certain health screenings that should be limited as people get older, because the risks can sometimes be far greater than the benefits. And even more troubling, most older adults are never told this information. Today we are going to break down the 3 most overused health tests in people over 70, and the reasons why so many believe these tests are helpful, even though they actually push them toward treatments they do not need. The second item on this list is something almost every older adult has done at least once, and it might be the most dangerous of all. Are you ready to find out whether you or someone you love might be unintentionally harming yourselves instead of protecting your health? Keep watching, because in just a few moments, you will understand why the number 1 item on this list has caused so many families to regret their decisions. Do not look away, because this loop only closes once you know the 3 tests you should avoid the most. 3. Bone density testing, also known as a DEXA scan. When a single image can steal the peace of your older years. If there is one test that sounds completely harmless, even making many people believe that the earlier you do it, the better, it is the DEXA bone density scan. It is a quick image, with no needles, no pain, and you walk away knowing whether your bones are weak or strong. It sounds like too good of a deal to refuse, until you learn what hides behind it. For people over 70, almost everyone who gets tested is told that their bone density has gone down. But do you know what that really is? It is not a disease. It is normal aging, just like gray hair or wrinkles. Even so, countless people walk out of the clinic with a heavy heart, filled with worry. And worse, they step into a treatment plan they may never have truly needed. Many patients are immediately prescribed bisphosphonate medications, which are meant to make the bones stronger. But along with these pills come real risks: jawbone tissue death, irritation of the esophagus, acid reflux, and brittle bones that can break in unpredictable ways. What is even more shocking is this: a study that followed more than 1,200 women over 70 found that after 5 years of taking the medication, the risk of fractures dropped by only 0.3%. It is nowhere near enough to change anyone's life, but it is more than enough to make many people live with long-lasting fear. Rose's story, and how she almost lost the thing she loved most. Rose, 73 years old, had spent nearly her entire life teaching piano. She was healthy, sharp, and had never experienced a bone-breaking fall. During a routine health checkup, her doctor suggested a DEXA scan. The result: reduced bone density. Not osteoporosis, just the natural decline that comes with age. Yet, the prescription was written anyway. After only 3 months, Rose could no longer teach. Her jaw ached constantly, and her stomach burned every night. The hands she once used to create music now had to leave the piano keys behind. When she stopped the medication and replaced it with vitamin D, resistance exercises, and calcium-rich foods, everything changed. 1 year later, Rose returned to the piano, walking steadily, without a single fracture, and without needing any medication. The most important message in this section is this: for people over 70 who have no history of falls, injuries, or urgent symptoms, building strength, improving balance, eating well, and taking vitamin D can reduce fracture risk by more than 20%, far beyond the 0.3% improvement from medication. A single scan should not decide the quality of your older years. But what is even more frightening is that the next test can lead to surgery, biopsies, and harm that no one saw coming. Number 2 is a type of screening that many older adults have done, believing it is simply being careful. But sometimes, it is the very thing that opens the door to unnecessary interventions and even danger. 2. Brain MRI scans when forgetfulness begins. When clearer images are not always the right answer. If there is one medical test that brings older adults both hope and fear, it is the brain MRI used to check memory problems. The moment someone forgets the name of an acquaintance or puts their keys in the wrong drawer, many immediately think, "Am I starting to lose my memory?" The fear of Alzheimer's makes many people request an MRI, believing that a picture of the brain will give them a clear answer. But here is the biggest irony. An MRI is incredibly clear, yet it rarely solves mild memory issues in people over 70. At this age, most scans will show scattered white spots, slight brain shrinkage, and small structural changes, and all of that is completely normal for aging. However, the moment the word abnormal appears on the report, a perfectly healthy person can suddenly turn into a frightened patient for weeks. Even worse, vague results often lead to a chain of unnecessary invasive tests, spinal taps, brain biopsies, and cancer monitoring even when there is no sign of disease, while memory may not be declining in a pathological way at all. A 2021 study on more than 3,000 MRI scans in people aged 70 to 85 found that 86% showed abnormal signs, but only 3% actually had a treatable condition. That means 97% received fear, not answers. George's story, when a single scan put his entire life on pause. George, 74 years old, a retired engineer, intelligent, functioning well, only occasionally forgot his keys and sometimes recalled names a bit slowly. His doctor sent him for an MRI. The result: white matter changes. No clear explanation, no guidance, just a cold line on a report. George panicked. He stopped driving. He stopped going to church. He withdrew from life, simply because he believed he was truly losing his memory. When he was reassessed using a standard cognitive test, his score was completely normal. We simply guided him to maintain a regular sleep schedule, stay hydrated, and exercise his brain with thinking games. 3 months later, his memory returned to its usual stable level. No medication, no surgery, no second MRI, just understanding and no panic. So when is an MRI actually needed? Only when serious neurological signs appear: rapid disorientation, unusual personality changes, seizures, weakness, or paralysis, or memory decline that gets progressively worse. In most cases of mild forgetfulness, a simple paper-based memory test is more effective, inexpensive, safe, and does not cause fear. We have just gone through 2 tests that seem normal, yet can turn life upside down. But the third test is the one many people believe is absolutely mandatory in old age, repeated on a schedule, and assumed to catch diseases early. In reality, it can cause complications: dehydration, bowel perforation, heart rhythm problems, and sometimes it is simply not worth the trade-off. One colonoscopy after the age of 70, when prevention sometimes opens the door to dangerous complications. For decades, colonoscopy has been considered the gold standard for preventing colon cancer. The moment a doctor says, "It is time for your screening," most people nod without a second thought. But after the age of 70, and especially after 75, the truth is no longer that simple. The reason is very clear, yet rarely stated. The risks of colonoscopy increase with age, while the benefits drop very quickly. The process sounds familiar: fasting, drinking extremely strong laxatives, bowel flushing, anesthesia, and the camera inserted into the colon. But for an older body, the preparation alone can cause severe dehydration, electrolyte imbalance, dizziness that leads to falls, and acute kidney injury from the bowel cleansing medication. Not to mention that once the actual procedure begins, the risks become even more frightening: colon tears, internal bleeding, heart rhythm disturbances from sedation, infections, and the need for hospitalization. The worst part: the polyps that are found are often very small, slow-growing, and do not need to be treated immediately. But once they are seen, patients are usually advised to remove them just to be safe. A large study of more than 1,300,000 people over the age of 70 found that for every 1,000 colonoscopies performed after only about 2 people gained real benefit, while more than 20 suffered serious complications. The risk was 10 times higher than the benefit. Dana's story, a lesson people never forget. Dana, 73 years old, had never had symptoms: no abdominal pain, no bleeding, no changes in her stool. She had already had 2 completely normal colonoscopies in the past, yet her new doctor still recommended another one for peace of mind. During the procedure, a small polyp was removed. That night, Dana experienced severe abdominal pain and fainted. When she was taken to the hospital, doctors discovered a perforated colon, a rare but extremely dangerous complication. She stayed in the hospital for 9 days, lost 10 pounds, and spent months regaining her strength. The most painful truth: she never needed the colonoscopy in the first place. One just to be safe decision cost her months of recovery. So what is the safer alternative? For people over 70 who have no concerning symptoms, at-home stool tests, such as the FIT test, should be prioritized. They require no anesthesia, are non-invasive, and are highly accurate in detecting worrisome signs. A colonoscopy should only be considered when red flags appear: rectal bleeding, clear changes in bowel habits, unexplained weight loss, or persistent abdominal pain. In those cases, the procedure is necessary, but doing it routinely for reassurance can sometimes take away the very reassurance you are seeking.